Today, we're diving into two cardiology conditions that often cause confusion. Myocardial infarction with non-obstructive coronary arteries, or MINOCA, and occlusion myocardial infarction, better known as OMI.
Yeah, both involve heart attacks, but they present and behave pretty differently, making them fascinating to explore.
It's like a medical puzzle.
Yeah.
Right. So let's start with MINOCA. What makes it so unique?
Well, with MINOCA, you see classic heart attack symptoms, but the angiogram shows less than 50% stenosis in the coronary arteries.
So no major blockage, but still a heart attack.
Exactly. No significant blockage in the main arteries, but those heart attack symptoms are very real.
That's where it gets tricky.
Absolutely. And it's not a rare thing either. MINOCA accounts for 5 to 10% of all heart attacks, and for some reason, we see it more in younger women.
Interesting. Why might that be? But first, let's address the elephant in the room. If it's not a blockage, what's causing the heart attack in MINOCA?
There are a few possibilities. One is coronary artery vasospasm.
Which is?
It's a temporary tightening of the coronary artery, like a spasm, basically.
Okay, so that restricts blood flow to the heart muscle.
Exactly. Another possible cause is microvascular dysfunction. That's where you have problems in those tiny blood vessels branching off the main coronary arteries.
Like smaller side streets trying to handle the traffic, diverted from a closed highway, but they just can't cope.
You got it.
And to make things even more complex, sometimes the heart muscle damage isn't even related to the blood vessels at all.
Right. It might be other factors mimicking those heart attack symptoms.
So figuring out the cause of MINOCA is a real detective job.
It often requires a lot of investigation, ruling things out, considering different possibilities.
Okay, now let's contrast that with OI. This one sounds a bit more straightforward.
It is. The name says it all. Occlusion myocardial infarction. Full blockage.
Okay, so no mystery there.
Right. And it's usually due to a blood clot.
And that's a serious situation, right?
Absolutely. Complete blockage means serious damage to the heart muscle. This is the classic heart attack that most people think of. Requires immediate action.
That's a full highway closure. You need to reroute that traffic fast.
Yeah.
So we have these two conditions, both heart attacks, but very different routes. To help us understand, let's look at a comparison.
Good idea. This will highlight the key differences.
First, coronary status. MINOCA is non-obstructive, less than 50% stenosis. OMI is complete blockage, occlusion. Big difference.
Huge. Then you have ECG findings. Both can present with STEMI.
ST, elevation myocardial infarction. That's the severe heart attack pattern on the ECG, right?
Right. But you can also see NSTEMI, the less severe pattern in both.
So the ECG alone doesn't tell the whole story.
Exactly. You need the full picture. Symptoms, history, other tests.
Right. What about prognosis? How do MINOCA and OMI compare there?
Generally, OMI has a worse prognosis. It's urgent, higher risk of things like heart failure, even death.
Time is muscle, as they say.
Exactly.
And MINOCA.
Well, short-term, MINOCA patients usually do better than OMI, but they're still at higher risk long-term compared to the general population.
So not a minor issue by any means.
Not at all. Even if that initial event is less severe, they need careful monitoring to prevent future problems.
So different prognoses, and we also talked about the different causes. MINOCA could be vasospasm, microvascular dysfunction, even something totally unrelated to the heart vessels.
And OMI, it's usually that blood clot blocking the artery.
Okay, so we've got a good grasp on the basics of MINOCA and OMI.
And I think the biggest takeaway is that both of these conditions are serious and require a careful, individualized approach.
Well, thanks for joining me on this deep dive. And for our listeners, keep learning, keep asking questions, and keep advocating for your health. We'll see you next time on The Deep Dive.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.